Okay, ladies, so I'm very sorry the Zoom meeting went off. So I want to talk about mental health and breast cancer. Then I'll talk briefly on how it affects us as ladies and how we can protect ourselves regarding that. So I left off by saying that when we talk about mental health, then we also want to talk about a definition to it, and we say that it's realizing your abilities, being able to cope with your stresses, and be able to work meaningfully and contribute to yourself and then the larger society as well. So, three major themes. That's on a broader level, and that's the World Health Organization's definition of mental health. But when we talk about mental health, then basically we are looking at the domains of wellness, and I showed you the paradigms to it, and within that we have our eight domains. We have spiritual, we have social, we have mental, we have physical, we have intellectual, we have career, we have financial. Very important domains to well-being. So I want to talk briefly about its effect on breast cancer. So with the physical domain, obviously there are changes in the breast area. If they have to go through surgery, women who have breast cancer struggle with self-acceptance and body acceptance, and then partner acceptance as well. First, they have to grapple with the new configurations that are coming around their body. They have to adjust to the changes in terms of, sometimes dress code. You can't wear all kinds of dresses. You can't wear the bare neck and chest and all that. Medically, you'd be advised not to expose that area to the sun and all, especially if you've had radiation and all. And so there's a lot of changes and adjustments around body acceptance, self-acceptance, and then beyond them is social acceptance. There's social stigma, and partner acceptance as well, obviously because of the changes coming around. I also indicated that breast cancer, as part of their mental health, breast cancer patients also have to deal with mental or cognitive changes and sexual dysfunction. Some breast cancer treatments affect libidinal and energy. And when we talk about libidinal energy, mainly sexual energy. So especially when it's estrogen positive and hormonal and all, some of the medications tend to suppress the hormones or estrogen, and that can in turn affect sexual function. So you find that most of the women have low sexual or sexual energy and libidinal energy. Then in terms of social stigma extending to friends and family, there's a lot of social cultural variables around that. You find that most of the women are told that they are demonized, they need some sort of deliverance. Breast cancer is seen as a result of sin and all that, and there's a lot of religious explanations that are given to that. So the women struggle a lot around that, which affects their mental and emotional health in many ways. I talked about some of the comments. Someone indicated that I felt like killing myself when but I didn't want to die because of my only daughter. Another one also indicated that they told me they wanted to remove my ovaries and my breast because of the estrogen positive cancer. And I told myself that I'll be a man then. I felt so sad, and I'm a good Christian. So I wondered why this. So obviously you can see traces of suicidal ideation, depression, anxiety, panic disorder, all mental health disorders coming around this experience for most of these patients. So I want to talk about some of the symptoms of depression, what to look out for. So you realize that most often the low moods, loss of interest in daily activities, changes in sleep pattern and eating patterns, feelings of despair. You find that there's a lot of conflict with interpersonal relationships, loss of interest in self-care, which are very, very critical to well-being, basically. I want to talk about the myths and stigma. Basically, when we talk about the myths, we are talking about some of the statements that are pacing around this phase. First of all, is the perception that breast cancer is a feminine disease. So it's not. We have a very, I won't say significant, but some men are affected by the disease as well. So in terms of myths, it's not a feminine disease. Men are also affected. Then the bit on demonization I've already talked about. Then also the fact that breast cancer is infectious. So you have some of the women saying that when they come around groupings, people move away from them. They feel that they are going to infect them with the disease and all. Very, very pertinent to their mental well-being as well. Then it's seen as a danger or a bad omen. Yeah, so if you have cancer, it's a bad luck or omen and all, basically. And there's also that perception that if the breast is sagged, then there wouldn't be any cancer and all. There are some nuances in those statements, because I've met women who have had the experience of breastfeeding and all, and experienced breast cancer, even with good breastfeeding. So it's still an area that is not clearly consistent with the findings that are coming around it. Maybe we need more studies or data to support, especially with the breastfeeding. And then if your breast is sagged by a partner or a spouse, or and all that, there's a less likelihood that you get breast cancer. So because of all these myths, with the myths that are coming around, that you find a lot of struggles coming from these experiences for women who have had the disease. Stigma is a tag you put on someone, and based on that you judge the person, you judge or treat the person based on that stigma, on that tag. So if that tag is blue, you treat them in a blue way, kind of. That's just an example. If it's red, so you find that I talked earlier on about self-stigma, social stigma. So breast cancer patients treating themselves in a very not so pleasurable way because of the inward struggles that are coming around the experiences, and then outwardly family, friends, even in terms of disclosure and all, struggling around explaining to other people what's happening to the friend or sibling or relation and all. I think we can't talk about mental health and breast cancer and not talk about our stress management, especially in terms of the domains of wellness. I always tell women that there's a direct correlation, and even studies are supporting it, between our physical health and our mental health. Like we rightly say, garbage in, garbage out, and even when we want to work on our weight and all, we are careful about what we put in. It's the same thing that works in mental health. So think right, manage your stress as well. Managing your stresses means that you also know yourself better and you understand how your stresses affect you emotionally, especially for women, emotionally, the relationship distresses, um yeah, and the mental distresses as well, the emotional are you handling relational difficulties? It could be partner, it could be friendship, it could be even yourself, a relationship with yourself, and we say that emotional health directly will have an impact on your physical health. So please, women, let's pay attention to ourselves. Know your stresses. Know your stresses within all the domains of wellness. If it's financial stress, know how it's presenting and know your threshold to your stresses. If you find that you are getting to the point where it's becoming overwhelming, please reach out. And we say that when we talk about not being able to sleep, having the somatic symptoms, your heart is racing, you can't sleep, so insomnia is setting in, you are hypersensitive, you can't eat well, you can't think right, um, your thoughts are flooded with negative thinking patterns, then you know that you are poorly managing your stresses within all your domains of wellness. It could be financial stress, it could be emotional stress, it could be psychological stress, it could be career stress. These days we see a lot of stress coming around career progression and all that. Women are being very competitive in the workplace. They want to get ahead, and there's no thinking pattern around wellness and how they can navigate physical health, emotional health, and attain a proper family health and attain a proper family health within